within days and sometimes even hours, we were able to stand up dashboards that were used by the command center to be able to see what is the flow of the COVID population in the state, in the city, and then at our institution. My name is Jawad Khan, and I'm Director of Data Sciences and Knowledge Management at Rush University Medical Center. At Rush University Medical Center, we took a very proactive approach for handling COVID crisis. When the COVID landed in US early March, as we learned in Seattle and in other cities, Rush immediately, very proactively established a command center. And as we stood the command center and started to manage the crisis, we immediately realized that we couldn't do it without having actionable data in front of the people who are part of the command center, so that they can make appropriate decisions about bed management, ICU management, vent management, supplies, PPE, etc. The more important aspect of data in the very early stages was, like I said, was to pull the data from our ERP systems, from our HR systems, supply systems. Also to pull the data from our third-party systems that folks use to dispense some of the PPEs. This data looks very different in each system. It's stored and using different formats. So we had to use quite a bit of data engineering skill sets to be able to massage the data, store it in an appropriate data warehouse, and then provide it as dashboards for our folks in the command center. Rush is unique in the sense that we are using data to provide insights to the institution to be able to manage the disease, but at the same time, we are also coordinating an effort to aggregate data from other institutions to provide a citywide view of what the data would look like. So we had, partnerships across quite a few people actually for the COVID response. We worked very closely with Microsoft. We worked very closely with partners like KenSci. In fact, we use Databricks as our product for doing some of the work that we do. So, Rush worked with KenSci a couple of years ago. So our relationship or partnership with KenSci goes back a few years, and we reached out to them again in the course of the pandemic because we wanted to evaluate or basically speed up the process of collecting data from other institutions, specifically in this case HL7 data. And currently there's a project in flight where we're working with KenSci to best use our HL7 data, parse the HL7 data into appropriate FHIR resources, FHIR bundles, or even SQL, and provide that as a front end, and use the data for reporting via dashboards using KenSci's front end, which is built, I believe, on top of Power BI. The value KenSci's platform and Azure Databricks in combination provides us is in our ability to be able to ingest ADT data in real time and provides near real-time analytics for our business users. This is significantly valuable for Rush because as we are managing through the pandemic, it gives us the ability to see the changes in our hospital resources and how it's being used and what's being utilized in near real time. I cannot overstate the benefit of having that real-time reporting available. In the case of COVID, the real-time data is important because, one, as we were anticipating a surge, just to give you an example with numbers, in the very initial phase of the pandemic, Rush was providing care for 25% of the patients in the state of Illinois. So, we had become the center for COVID, at least in the Chicagoland area. So it was important for us then to be able to do this management in real time so that we can continue to provide care for our patients who are already in our institution. It would be almost impossible, I believe, to manage a pandemic of this nature without having data in near real time available to us.